Hi, good morning all, and thank you for this opportunity to present at EEHF 2025. My name is Nazar Rehman, Operation Manager for Pakistan Floods. Today, I will be sharing our experience from southern Pakistan, where we tackled one of the most urgent and overlooked challenge in humanitarian response, providing sustainable sanitation solutions in flood-prone areas following the catastrophic 2022 flood that displaced over 33 million and devastated sanitation infrastructure across the country. From the beginning, we knew we needed to think differently. What emerged was an innovation rooted in resilience technology and community-led action model for future-proofing sanitation through GIS-Mapped, climate-resilient latrine and sanitation infrastructure. This slide presents the overview of the flooding in Pakistan and reflect the challenges the community faced after the flood 2022. Significant humanitarian needs in the flood-affected communities prior to flood 2022 in Pakistan. Flood timing and intensity, widespread diseases outbreak, health facility destruction, unsafe drinking water, hygiene and sanitation concern, as well as food water insecurity. The floods not only disrupt the livelihood of the local community, but the recurring flood devastates sanitation infrastructure, uh, causing contaminated water sources and increase in the disease outbreak, infrastructure losses after each flood, and communities are trapped in the cycle of rebuilding. How we were able to meet the community needs using the community-led model and using the GIS map technology. From the very beginning, community participation was at at the center of the program. So we initiated the participatory planning process where community-led site selection and design was adopted by the community. Then the selection of the beneficiaries were initially prioritized women, elderly person with and person with disabilities. Also, we were considering to meet specific needs of the women and people with disability. So whole this process was initiated through the consultation with the communities at the different stages. The program also ensured the integration of the protection, gender and inclusion component in the integrated health and wash component, which ensured a dedicated female staff, promoted women participation in wash interventions, and women representation was ensured in vigilance committee through an effective complaint and feedback mechanism. Engaged over 3,500 women, including 50% with disabilities and elderly, in the site selection for the latrine and hand pumps, promoting inclusive participation and ensuring accessible water sources and sanitation for vulnerable groups. After the consultation and feedback from the communities, the program team was able to design elevated flood-prone design which was accepted by the communities that include the septic tank and soakage pit as well as the drainage. The material was used during this construction was flood resilient, including bricks, mortar, cement and steel bars in the construction of septic tank and the superstructure. All these latrines were mapped with using GIS technology like Google Map. Initially, 5 districts were selected for the pilot project, with 200 household latrines were constructed during this pilot. At the later stage, the program scaled up, and as a result of the direct response of 2022 flood, over 1,500 household latrines were constructed across 4 provinces of Pakistan. These efforts were supported by IFRC, CRC, and other donors and implemented by Pakistan Red Crescent Society. A simple GIS mapping technology like Google Map were used to map all these latrines, um, which can overlay the flood zone for planning, and data is usable for the national society, partners, local government for monitoring and future planning. The major impact and outcome the program managed to achieve after this implementation were reduction in the open defecation, dignity and safety for women, informed decision making using GIS data, and reduction in the spread of diseases. The progress on the immediate outcome end-line result benchmark against the baseline shows a significant improvement in water and sanitation interventions, including access to drinking water supply, hygiene condition in communities, latrine and waste management, and hand washing, as well as the wash committees availability at the community level. This slide shows significant improvement in all these areas. With wash and health integration, the most of the end-line result reflect the very positive outcome of the intervention, mainly reduction in the diarrheal diseases, privacy of the women, and lowering the health cost. The approach is not a very scientific kind of approach. I think it is applicable in the most of the flood prone area in the similar context. GIS-based planning enables smart expansions of the program. Like during the pilot project, were we started over 200 household 18, and then we were able to scale up these construction process to 1500 across 8 districts of the flood affected provinces in Pakistan. So major focus was in Sindh, but also we considered Balochistan, KP, and Punjab for these intervention. Apart from this, the community monitoring itself is one of the major component that keep this intervention as a sustainable and resilient solution for the community. The challenges faced during the implementation process was the widespread illiteracy and low awareness of the local communities, as well as meeting the complex need of the diverse community, uh, navigating the political, bureaucratic, and logistical challenges across the implementation areas, and vicious cycles of poverty, low income, limited literacy, and low productivity, high vulnerability to extreme weather events, including heat wave, drought, and floods, underfunded and overburdened public sector, rigidly defined social norms and culture. My presentations concludes here, and thank you very much for your time. And any question and comments are welcome. Thank you.